Are you going for surgery? Know the risks before your surgery. With any surgery, there are risks. Every type of operation have their specific risks, but there are generic risks that ring true for most operations. These include risks for complications that occur during the operation, as well as those that occur after the operation. Fortunately, the majority of complications noted during the surgery can be addressed at the time of the operation. The most obvious complication is bleeding. A degree of bleeding is expected during surgery because surgery involves cutting through body tissue. Excessive bleeding may be encountered when larger vessels are cut. There are a number of operative techniques used to stop bleeding, and the majority of bleeding, even if unexpected, will be dealt with at the time of the operation. Occasionally, there may be small vessels that bleed that are not immediately obvious during the operation. This may lead to a collection of blood after the operation, also known as a hematoma. These may be self-limiting or may require another operation to remove the blood clots and control the bleeding. Depending on the amount of bleeding you experience, you may also need a blood transfusion to top up your blood count. Your bleeding risks may also be increased depending on your medications. Certain medications, commonly known as blood thinners, are designed to prevent blood clots and hence promote bleeding. These include anticoagulant medications such as warfarin, also known as Coumadin or Maravin, apixaban, also known as Eliquis, dabigatran, also known as Pradaxa, and rivaroxaban, also known as Xarelto. These also include antiplatelet medications such as clopidogrel, also known as Plavix, Iscaba or Coplavix, Prasugrel, also known as Effient, dipyridamole, also known as Persantin or Astaxanthin, and ticagrelor, also known as Brilinta. Some complementary or alternative medications, such as fish oil and turmeric, may also increase bleeding risks. Because of this increased risk, we may ask you to stop these medications prior to your elective surgery. There are a number of general complications that may occur after surgery. The most common is an infection. These can occur at the site of the incision where the skin is cut, which we call wound infections. A number of factors can affect the risks of infections, including operative factors such as the type of operation, because obviously operations performed to treat infections have a higher risk of wound infection. But also underlying medical issues such as obesity, diabetes, smoking, and taking immunosuppressant medication can also increase the risks of wound infections because these conditions impair wound healing. In addition to wound infections, simply being in hospital increases your chances of chest infections and urinary tract infections. Surgery can also be a stressful event, not just mentally, but physically. Your body is put through a lot of strain for the duration of the operation, and this can cause a strain to your heart and brain, leading to heart attacks and strokes. These are uncommon and usually only affect people with pre-existing medical conditions that already place them at higher risks of heart attacks and strokes, but can affect anyone. Surgery and the post-operative period may involve prolonged periods of lying still. This increases the risks of you forming blood clots in your legs, known as deep vein thrombosis, or DVT. These can cause pain and swelling, and the clot may break off and end up in your lungs to form a pulmonary embolus, or PE. If untreated, this can be fatal. Fortunately, we take a number of precautions to prevent this, including using special TED stockings and injecting blood thinning medications to prevent clots. If you do develop a DVT or PE, you may require months of blood thinning medications to treat these. Prolonged bed rest may also cause pressure injuries to areas of skin that are in prolonged contact with the bed. It can also lead to collapse of your base of your lungs and deconditioning of your muscles. This is the reason we do not promote bed rest after an operation and want you to get up and moving as soon as possible. While I hope that you are now adequately informed about the general risks of surgery, please watch my other videos for specific risks relating to surgery and anesthesia. And please remember to like, subscribe, share, and comment for more videos.